I'm Nirish Mathias, CEO of DocPanel. We operate a digital health company that has a marketplace for subspecialty radiologists. We serve large hospitals, health systems, academic medical systems, freestanding imaging centers and patients, and connect them to the best specialty radiologists. DocPanel is a mission-driven company. Two of the founders, including myself, had a family member go through a traumatic medical diagnosis. In my case, I lost my dad to a medical diagnosis. So everything that we do, no matter who uses the platform, is driven around outcomes for patients. And so by taking technology and allowing the expertise to come into one single place, we're actually fundamentally shifting how radiology is being delivered. The primary challenge that we solve is access. Even though you have more than 500 million radiology scans done a year in the US, more than half of them tend to get read by a non-specialist. And the analogy is that you wouldn't let a carpenter do your plumbing or a plumber do your carpentry, so why would you let a neuroradiologist read your knee? Because they've specialized in the head and neck. So our platform aggregates the unutilized capacity of fellowship-trained specialists and puts it in one place. When a specialist reads a case that, let's say, a non-specialist had read, at least 30% of the time, the diagnosis is either updated, upgraded, or changed. Because when you are a specialist, you're reading that same exam 10,000 times a year, 12,000 times a year, your eyes are more likely to catch that specific disease. Now, most of the stuff is routine, it's not really a problem. But if you miss that one thing that's not quite there, or you stage a cancer wrong, for example, it has severe outcomes. DocPanel has currently established its primary line of business, which is remote reading subspecialty radiology across the country. So now that we are, ingesting 300,000-400,000 radiology studies every month, because every study you get all the priors, we're looking at building advanced information derived using AI to help predict certain outcomes. We are starting to take the network of both the clients, which represent about 5,000 imaging centers and the 700 radiologists, to the pharmaceutical industry to help with research and development, clinical trials validation, and drug rollouts. And so that's the next new phase, which is effectively AI in the pharmaceutical.